Here we're going to go over a ultrasound done on a 46-year-old male, about 15 months, status post Achilles tendon repair for a pretty severe rupture. Here's the Achilles tendon on a long axis. You can appreciate severe bogginess and thickening of the Achilles tendons. Also, you can appreciate the sutures and some shadowing underneath the sutures, as well as a mild case of peritendinitis as well. As you can see, that dark signal kind of contouring the underbelly of the Achilles tendon. Here we're going a little bit proximally. Again, you can appreciate significant shadowing underneath some sutures in this repair. You can also appreciate the soleus muscle feathering into the Achilles tendon, and you can appreciate Kager's fat pad and the underlying flexor hallucis longus muscle. And again, you can appreciate the sutures with shadowing, and as you go proximally, the tendon certainly thins out, but still somewhat abnormal in thickness, as you would not expect it to be this thick, this proximal. Here's a better view of the flexor hallucis longus muscle as well as the soleus muscle. You do not see Kager's fat pad in this view. And now we're going back distally towards the insertion. And again, you can appreciate severe thickening and bogginess of this repair. Hopefully this will remodel over time and thin out, but he is already 15 months out from the surgery. Here you can appreciate sutures kind of running the length of the tendon here, again with some shadowing underneath some of the sutures. I would not read that as tears of the tendon. Again, that's just shadowing artifact. Now we're going to look at the Achilles tendon in short axis view. So here we are at the calcaneus, and now we're going proximally. Again, you can appreciate some shadowing underneath the sutures, which appear to be bright hyperechoic lines and dots here. Also, you can appreciate almost a circumferential peritendinitis in this view. And also on the right and left sides of the screen, you can notice that it's black, as essentially in this area the ultrasound probe is not in contact with the skin. Here we are going proximally. The Achilles tendon is starting to somewhat normalize in size, but still quite thickened. There's also a hypoechoic signal throughout the Achilles tendon consistent with tendinosis. And you can appreciate sutures going across the thickness of the Achilles tendon. And here we're going proximally again, and you can appreciate that the tendon is starting to normalize in thickness.